Hello and welcome to SinglePayerRadio. I'm Paul Hoppe, broadcasting from the Habron Building in Louisville on the WFMP 106.5 Forward Radio Community Network. Our programs air every Monday at 2 p.m., Tuesday at 7 a.m., and Wednesday at 11 a.m. And we also stream our show on SoundCloud. The show is a project of Kentuckians for Single-Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. The views and opinions expressed on our show are those of the speakers and not the station. Our station relies on volunteers like myself and your ideas and donations to keep us on the air. Today, the chairperson of Kentuckians for Single-Payer Healthcare is going to lead a discussion on the fight for unionized Starbucks employees to obtain a contract from the company that provides fair wages and other benefits, including affordable health care. Let's get started.
My name is Kay Tillow, and I am joined by Paul Hoppe and Charlie Casper. All of us are a part of Kentuckians for Single-Payer Healthcare. We are working to enact national legislation that would cover every person in the country for high-quality healthcare with no payment at the point of service. And today we are fortunate to have with us one of the leaders in the struggle to win rights for the Starbucks workers. Her name is Tamara Bell, and she is involved here in the city of Louisville. And we're honored to have her with us, and we want to hear about the story of what's happening with those workers and their union, but also about the healthcare issues that are involved with those kinds of workers. And so we're eager to get started. Welcome, Tamara.
Hi.
Okay, let's just start. Can you tell us how long have you worked at Starbucks?
I have worked at Starbucks for 4 years. It'll be 5 years in May. I work as a shift manager. So looking for how many Starbucks unions there are in Louisville, I believe we have about 8 off the top of my head. And employer wise, I believe we probably have over 45 people employed between here and Indiana. And how I got involved with Starbucks Workers United was I was approached by another young lady that started her union at the Bardstown and Heather store. And she came up to me and she's like, hey, you seem to have a lot of people in the store that are behind you in your corner. How do you feel about unionizing? And I said, well, as somebody who used to work for UPS, I was a Teamster. So I'm like, or if you're trying to unionize Starbucks, that's going to be an uphill battle, but I'm for it.
Wow. Was that a long time ago?
So we have been unionized at my store for 3 years. It will be 4 years coming up soon as well. So yeah, so we've been in union, established union for 3 years.
And did you go through an election?
So yes, we were the first store after COVID to have an in-person election.
After COVID, so that was in couple of years ago, huh?
Yeah, so right as COVID was seemingly wrapping up, I guess it would be the word.
What impact did COVID have on Starbucks workers?
I came to Starbucks in between that time. I was working for Dunkin' Donuts at the beginning of COVID. So I was coming in Starbucks as COVID was still in its hype. And I think for me, when I transferred from working from Dunkin' to Starbucks, it was masks were still required. You had to sign in every day. And if you were to get sick, it was you go through this list of what your symptoms are. And if you're fine to work, you would work. But if you're not fine to work, you would stay home for 7 days.
So for Starbucks workers, there was no work from home.
Yeah, there was no work from home.
No work from home. So you were like the frontline people doing service throughout that difficult time. What were or are the issues that made you and other workers decide you wanted to have a union?
I think the main issue, if we're talking about like my store specifically, was wages and healthcare. Because we have people at our store that are transitioning and they have the hardest time trying to get healthcare or trying to establish what their healthcare is. It's like, okay, this is you're considering this cosmetic as to opposed to that this is life-saving surgery for somebody who needs it.
Mm-hmm. And what are the wages for Starbucks workers?
So right now wages are I believe 16 an hour for the basic barista, but for my position cuz I'm a shift manager, we make up to $19 an hour.
Uh-huh. And did the wages go up while you were trying to organize?
So yes, the wages did go up. We did get a small raise, probably like basically like a 60-cent raise.
Uh-huh.
Um, but we were asking Starbucks to create more of a wage, like to increase the wage, sorry, instead of like 60% or 35%. We asked for a little bit more because we weren't given a number. So we gave them a number.
Mm-hmm. And what were the obstacles you faced when you were trying to organize your union?
I believe it was more of the apprehensive of the managers. It was like, okay, we don't want this in our store. We don't want this in the Starbucks company. So we're going to try to do anything necessary to keep you all from doing that. Like whether it be phone calls, like, hey, this is what's going to happen if you decide to unionize, or talking about if your benefits will be taken away. And I personally have had a manager call me 3 to 6 times to talk about my benefits being taken away.
Oh,
So
really? What did
yes,
what did they say?
they were like, "Hey, Tamara, do you know that if you guys decide to go down this route and unionize, that the Starbucks could take away your like healthcare benefits?" And I'm like, "I'm so sorry. I don't know if you probably think I was born yesterday, but I worked for a union, and that's not how that works." So they don't just take away your benefits overnight.
Well, that actually is illegal to threaten to take away your benefits because you have made a decision to join the union. Um, was that rampant, the company's efforts to stop you?
Oh yes, that was like rampant across the board, not just myself, but many other people that I've met through this campaign. Um, and like hearing their stories and people who have been fired, people who have been brought back to the company, who have been let go for unjust reasons. So those were the things that were happening. Like if you were an organizer like myself, you were basically, I don't want to say the word targeted, but you were basically the number one to go. And if they found something that they didn't like, it was easy for them to let you go during that time.
Were workers fired here in Louisville?
I think we had like a couple of them. Not like I've spoken to some of them, and some of them have fought like cases to come back to Starbucks. But we had like probably like 5 to 10 people who were fired off the top of my head.
And but people kept going anyway.
Yeah.
Charlie?
Tamara, how many people are part time, and are any people full time?
So with Starbucks, you have to have open availability. I don't know, like we've had conversations such as myself with my actual manager, and it was like, okay, what's considered part time? Because we have 2 people in my store that technically are part time because they have another job. So Starbucks, it's a little iffy on who's part time, who isn't, but mostly everybody is full time with Starbucks. unless you have a circumstance where you have a second job and then you're considered part-time.
Okay. So full-time is how many hours a week?
For myself, because I'm a shift, so I make about at least probably 30 to 35 hours a week or less than that.
Okay.
For average barista, they make more. They should be making between 12 to 20, but it depends on if the store needs that barista more. Like my store doesn't have a lot of workers, so baristas get up to almost 30 hours.
Okay. Okay.
And the number of hours, does that impact your healthcare coverage? Or just tell us about the healthcare coverage and the issues there.
So it does impact the healthcare coverage. So you have to meet for a barista, you have to meet, I believe, the minimum of 12 hours. I could be wrong. I'm gonna have to go back in handbook for that. But the minimum of 12 hours to fall into the healthcare slot. The same thing with me. I had to have a minimum of set amount of hours to keep my healthcare. So that does affect, like, if you don't get enough hours, like most baristas don't get 12 hours. Managers do try to give them a good amount of hours. But when there's hour cuts and somebody's getting 12 hours, then, then they're not eligible at that time to meet the criteria for their insurance.
So people can go in and out of being insured? Is that what happened?
So I believe I've never experienced this, in almost much of the majority of the people in my store. Some of them are on like their parents' insurance, or one or two have actual Starbucks insurance. But I myself, I wouldn't be able to answer that question because I don't quite know. But I believe that from what I've heard from other people, that you do lose your insurance, you would have to reapply to get your insurance in the time frame or when insurance starts again.
Mm-hmm.
So if you lose your insurance, you're losing it for this much amount of time unless you go through a procedure in Starbucks to get it back.
So you're exposed for that time. No
Yeah.
coverage.
Yeah. So you're exposed.
Jeez.
Go ahead, Paul.
Does Starbucks issue an employee handbook that has these kinds of things delineated in it, and is it comprehensive?
So given now that we have a new CEO, the handbook has been updated, and I don't know if you all heard that we're changing our policies. Healthcare is not under that policy, but with that being said, I believe we're still implementing the old policy of you have to meet this criteria in order to, first of all, you have to, when you first get hired with Starbucks, you have to meet basically within, it depends on when you get hired, meet the criteria. You get insurance in October, or before October, I'm sorry. And then if you get hired after October, you have to wait until the next open enrollment period to get insurance. So
That seems a little incredulous to me. Is it like a rolling average? You have to maintain your 12 hours?
I believe so, yes. Because I don't have the handbook in front of me, but it is a rolling average that you have to maintain. You have to maintain a certain amount of hours. So I myself was very worried when I started doing bargaining and I wasn't physically at work to make sure I still kept my hours. And then the company was like, hey, we know you all are bargaining with us, so this is not gonna affect your work hours. Because I was very worried about like getting my health insurance taken away, because I'm like, I'm not physically on the floor. I'm physically on a plane, going to and from places to meet with the company. And so I'm like, okay, how am I gonna maintain my hours if I leave for 5 days in a week and I only get 18 hours? Like, even if that was a consecutive, it's like, okay, if I had got 18 hours, I still met my minimum. But if I was gone longer for, like, let's just say I only got scheduled for 1 day, that's less than 18 hours. And that can happen. That happens every week if I'm still continuously traveling with the union. And it's like, okay, well, then you'll get a letter from Starbucks and it'll be like, okay, hey, your benefits have been like ultimately either suspended or they're not there until the next open enrollment period. And this is what you have to do to get them back, or you have to wait.
You are a member of the union's leadership working to get a contract. Is that right?
Yes.
How did that happen that you are in that position, Tamara?
I want to say it was kind of like pulling straws, and I literally did not I didn't know I was gonna actually be going out of town and doing those things at the beginning of last year. So I was like, oh, this is great. So for me, I thought it was like a better experience because I get to actually talk to other partners.
Mm-hmm.
I get to actually get to experience other things that isn't just Louisville, Kentucky, and get to hear other people's stories.
Mm-hmm. You and your fellow workers went on strike on Christmas Eve. Is that right?
Yes.
Could you tell us about that? What was that about, and how did it go?
So first, it was the biggest turnout of supporters I think we've had in like the 3 years that I've been out standing outside going on strike, which I loved. I think for us it went very well. I think overall the strikes that came in waves went very well. A lot of support, which was great, which is what we needed. I think for like the company side, it was kind of like, y'all are just doing this every single day leading up until our biggest holiday. It's really not much for us to lose a little bit of money. So, and the company was very silent, which was kind of like, okay, y'all are being too quiet. So,
Well, it doesn't it take a lot of courage for workers to make the decision to go out on strike, since you don't have a contract and you're still in a fight with many things that are unsettled. And here's a company that's been firing workers for union activity. So how did you stand up to that?
I when I get on like all my interviews and I talk about how the company is and how our CEO, like how can our CEO fly, like afford to fly back and forth, and it's much more like on our backs. Like we are, us the workers are the machines of the company. We make Starbucks run, and I think in the long run, like that's what people still have to remember. The Starbucks runs off of the people it work like that they hire, or the people that source the beans. So I'm like, even if you don't, like, most of the people that source beans don't get paid. So it's kind of like, hey, you see us, we see you, we want to see the table, we want to know how to best help this company run and be profitable. Because at the end of the day, we're not just unionizing because we feel unjust. We're unionizing for a better peace of mind and a better life. And for the next people that come after me that will probably sit and interview and continue to do this. So that's mainly what I do, like why I want to be a part of this very good union, this very diverse union.
Mm-hmm. It's been kind of an inspiration to many of us who've been longtime union folks and who've gone through many a battle to organize, to see the courage of the people at Starbucks and other coffee shops who are standing up to the violations of their rights and sticking together and helping each other. So we congratulate you on being the new hope for a better country and more justice for working people. How do you keep the workers involved, since you're in a long battle for this contract?
I think it's more of keeping them informed. Because I'm an overtalker. I try to overtalk, especially when it comes to like union work. Like I attend a lot of union meetings and I spread that knowledge through my store so that they know. And I also like, hey, this union meeting is happening this specific time and date. Could you all try to attend? Trying to get the word out. And also with stores that are ununionized, which is more like leafleting, giving them the information like, hey, here's the information about the union. Here's the information that I'm pretty sure you've been told and was not correct.
Uh-huh. There's still non-union stores in our
Yeah.
area.
We still have several non-union stores between here and some parts of Indiana. So it's kind of, I believe we have, if I want to put a number on it, I think we have probably like 13, 14.
That are still non-union,
Yes.
and 8 are union.
Yeah.
So you've been growing, and those
yes.
have been, one at a time. You won those elections with the National Labor Relations Board.
Yes.
Okay. So you said that the issues of the contract is healthcare and wages. Is that? Those are the keys. Are there other issues?
So we had 3 keys, which was benefits, like maintaining a benefits, wages, and healthcare, especially for, like I said, healthcare for our partners that are trying to transition, and then wages so we get a better, like, wages in the sense of the cost of living is going up. We need to be able to match that cost of living. And then maintaining our benefits, like making sure we still have certain programs that are in Starbucks or instilled in Starbucks, like Starbucks partners with Arizona University to have us go to school for free while we work for Starbucks. Or we have a program that's called the Black Apron program, where we explore where all the beans come from, and then we get to travel to, I believe, Costa Rica. We had that taken away from us. Or the simple fact of keeping all the benefits that Starbucks gives when you first get hired, whether or not you're a union store or a non-union store. We wanted to be able, under the contract we've drawn up, to keep those benefits and maintain them.
Mm-hmm. To secure those, and
Yes.
to do wage increases, and to do health care. So
Yes.
Since we're a healthcare organization, let's go back to the healthcare. Have you had any of your workers that have had trouble in getting health care?
Yes, I had one or two. I had a young lady. She just left our store not too long ago. She had previously worked for Starbucks and left, and then came back and worked at my store. She was having the hardest time, like, trying to figure out how it all worked, what's the tier system with Starbucks, and ultimately missed her window. And she was uninformed. So the manager did not truly inform her about the benefits of the health insurance package. So she had missed her whole window, and she had to pay out of pocket for a lot of her, like, surgery fees and things like that. So it was kind of like, okay, how best to, like, be more informed if the manager's not informing you. And this young lady really, like, paid a lot, like most of her paychecks out of her pocket to make sure she can go to the doctor.
Oh. What is the tier system?
So the tier system is kind of like gold, platinum, silver, and so forth. And those systems, it depends. And then there's gold plus for our partners that are transitioning. That one I don't know too much about, but I do know about the regular tier system, which is what I'm on. I'm on the gold tier system, which does take more out of your paycheck. But it's for, like, a more coverage. So some tier systems, you have a certain amount of coverage. Like, you still get vision, dental, and eyesight. Well, vision, dental, and health. I'm so sorry. But you still get those under any of the tier systems, but it depends on how much is being taken out of your paycheck.
So what varies is the premium that you're paying
Yes.
But the coverage
so
is the same, or it varies too?
So the coverage, they had different, so Starbucks partners with different insurance companies. So if you're in that tier system, so I can say this out loud. So like with mine, so I'm on the gold, and it gives you a breakdown of who you can have health insurance with, gives you a list who is best coverage for eyesight, who is the best coverage for like which insurance company you should go with for each of the three. So they give you who they're partnered with, what the cost will be, and what best can walk you through of the best quality of insurance for you while you're working with Starbucks.
So is it a big premium that comes out of your check?
I believe for me, because they have gone up, the highest I think I am paying out of my paycheck for health, I believe, is probably $355.
Per what? 355
Yes. I
per?
think for like health, like to that's coming out of my check to go towards my healthcare insurance. Like they,
In
I'm like, oh,
a month, or?
I believe it's like within a quarter. So like you do get, I get paid bi-weekly. So those benefits go towards, like that money does come out like with taxes and everything else. That money does go towards that benefit. I don't know if it comes out every single paycheck, but I do know it's like a quarterly thing. So
Mhm. Are there workers who don't take the health coverage because it's too expensive?
we have some that are like, hey, I also have a young lady in my store. She was like, I should have applied for Starbucks insurance, but it's the cost of money that's coming out of my paycheck. So how am I supposed to live if I'm not getting as much money, and it's coming, like, it's great if I can go to the doctor, but it's not great if I can't afford groceries because all the money's coming out to go to the doctor.
I
Well,
hear you.
that's the terrible conundrum. It's food and rent or
Mm-hmm.
healthcare, and
Yeah.
it's a horrible decision to have to make.
Yeah. Or you have to work 60 plus hours to make up for that difference.
You know how much Starbucks contributes to the whole insurance package?
I'm none too sure. I do know, like, cost wise, I'm pretty sure it's probably a good number that they contribute to all these people that they pay out for health insurance coverage to pay for their partners. Um, so yeah, I really couldn't answer that one.
Um, uh, do you know what a deductible is? Do you know if there's
Yes.
a deductible that for
So
case?
the deductible, I think on my end, I'm just basing it off of my experience. Usually my deductible is probably like $25 to $40. It just depends.
That's like if you go to see a physician,
Yeah.
that's the part
So
that's the copay that you pay. Is there a part of the year when you have to incur so many expenses before it starts kicking in?
I want to say yes because I do receive letters like that. It's like, hey, this is what has this is what has been taken out through the year that you've had insurance, and there's a set amount of numbers, and most time I don't ever have to pay that number. It's just there. It's like, oh, this is what you have to pay, and then the number is never there for me to pay. So I believe with Starbucks, I believe they take care of that number, but it's also still coming out of your paycheck. So
Mhm.
in the long run, that number is still coming out of your paycheck.
Mhm. This is the problem for working people in our country, is that the health insurance isn't good enough to actually give people the kind of care and coverage that they need. And the money, the co-payments become a barrier. So we have close to 50% of the people in our country who skip medications that they need, or who don't go to the doctor when they need to, or who don't go to the emergency room when they need to, because of their concern about the money and the fact that it's fighting against what they need for the rent and for their groceries and for their children and for all of the other things in life. So that's the general problem. And I think that it's bad for workers in every industry, but I would think that for people in places like Starbucks, which have been unorganized, where the employer has been free to give or not give benefits, that, you know, you have a challenge to get a contract that will give the kind of coverage that you need. So what do you hope to accomplish in the area of healthcare in the contract?
I think thus far, I would like to accomplish getting back our trans supplemental health care. I do know it was taken away under administrations. Like, most businesses does not have them anymore. And they supplement a plan, kind of like I said, with the tiers. Like Gold Plus is what most of our partners who are transitioning are on, because they took away the trans supplemental health care. We are trying to find a way to make sure that a lot of the staff or partners, as a company likes to call us, are covered with an HRA, for not just if they're not going to bring back trans supplemental health care or that plan that Starbucks had, which they use as a come on in, we're a very diverse company, and if you want to try to transition, come work at Starbucks. Or we're LGBTQ friendly, and we're allies, we're trying to help. And that's what they use to get people in the door. But, you know, once people are in the door, it's kind of like, oh, you're kind of on your own. But we'll give you a healthcare plan, and you'll just have to figure out all the payments afterwards.
I see.
It's so complicated to me. Why does it have to be so complicated? You've got co-pays, you've got deductibles, you've got the company contribution, you've got the individual contribution. It just seems so purposefully complicated.
Yeah. And speaking from somebody that, I mean, I've seen a young lady go through all of her go through having to get therapy for transitioning, got her surgery set, and went to go get her surgery. And afterwards, they billed her about $1,000 because they said the company did not come up with the other half.
$1,000 means a lot to
a person, especially to somebody who's on a barista salary making $16 an hour.
Yeah, it's undoable.
It's not possible to face that.
You know, I'd like to go back and outline a little history on how companies started offering health insurance. That came about during World War II. I know that's at your age, that's a long, long time ago, but so during the World War II, the government actually put on wage and price freezes just to conserve assets to use in the war.
Mm-hmm.
So the companies couldn't offer money to attract employees. And since there were a shortage of especially men, they had to do something to attract employees. So they started offering health insurance, because that kind of went under the radar in terms of the wage freezes. So that was kind of an underhanded move all the way back in the 40s and 50s. So then it became very popular. And like I said, after the war ended, it continued and became even more popular. And today people kind of have the idea that that's just expected when you go to work for an employer.
Mm-hmm.
But that's fairly new in the history of our country, and it's really not necessary. I mean, as bad as it seems of the expenses you have to incur as an employee, the companies pay a whole lot of money on their side also. So common sense would indicate that, it looks like the companies would be behind our group, who we advocate for a Medicare for all, where the government pays everybody's health insurance. It's a system that works very well, and it works in the majority of the industrialized, wealthy nations in the world. So that's what we advocate for. So I just thought it might be interesting to you to have that little background. And if you were only looking for working conditions and wages, it would actually be easier to negotiate. But now healthcare has become a chip that's used on both sides for negotiations, and we would love to take that out of the equation.
Mm-hmm.
That's true. We're aware that we're at the bottom in terms of wealthy nations, in terms of our outcomes. We are 55th in life expectancy. Our maternal mortality rate is really, really high. We lose so many mothers in the labor and delivery and the birth process. And we're doing very poorly on coverage. We still, in spite of the Affordable Care Act, we still have 28 million or so who have no coverage at all. And that's maybe 9% or so of our population. But we have an even worse problem, and that is that we have millions and millions of our people who have coverage, nominally have a policy somewhere, either Medicaid or employer-based, et cetera, and still can't get the care that they need. And that's what we see as the crisis, which is why we are fighting to enact national legislation that would publicly fund healthcare, cover every single person in the country, cradle to grave, everybody equal, and all medically necessary care would be covered with dental and eyeglasses and long-term care and mental health and, our eyes and our teeth and our ears and all the pieces and parts that need to be watched out for. What would it mean to you and your fellow workers if we had such a plan?
That would be phenomenal. We wouldn't have to sit across the table and bargain for health care. It would be equal. We wouldn't even have that conversation. For me personally, I think it would be great, because at the end of the day, sometimes people get tired of struggling. There's been days where I've been so tired on this campaign and listening to other people's stories, and I go home and I break down and I'm like, I'm fighting for you all, and I'm also trying to fight for the simple fact of the matter that it's a scary place out there, especially myself being a person of color and someday wanting children, that it's a scary fact that I might not even make it out of the hospital room if I have a child, because that's how bad it is. So that's why I do what I do, and that's why I really want to push for a better healthcare system or better healthcare, because that thought scares me the most. And I'm thinking of other people who have to go through that, who have survived that. That's just a scary fact.
Well, we thank you for that support for our specific project, the contract that we want to negotiate with the nation so that all of our people have the health care that they need. And, we're a very wealthy country, and we have the ability to take the best care of everyone. We have, scientific research and good doctors and skilled hospitals and, the money that it takes to provide everyone with the care. And yet we haven't been able to accomplish it. So that's our goal. We're trying to get a contract with the country to publicly fund the health care for all of the people and to end the discrimination and the suffering. about, I think the figure is 68,000 die in the country needlessly every year, not because they had a disease that we couldn't cure, but because they couldn't get the care that we have the ability to give, and they couldn't get it because either they had no coverage or their coverage was insufficient to provide that for them. So yeah, we're with you. We want to, until we get that, which we hope to get as soon as possible, we have to fight, at the bargaining table to try to cover our people as best we can. What's the most important thing that you have learned from this struggle?
Oh my goodness, I have learned I have learned so much in my time of being with the union. I've learned that there could be other points of view, that what you're fighting for is a great cause. I learned to broaden my horizons, especially meeting other people in other places, and like just hearing their experience for me has just broadened my will to push on and to keep fighting for a fair contract.
You think you're going to get it?
Oh, you know what? I'm going to say this because I'm very much an optimist. I said this before. I said this last year, and I said, we're going to get a contract. One way or another, we're going to get a contract.
Good for you. Good for you. How many are on your bargaining team?
So as of right now, I'm like Louisville, Kentucky wise, I think we have, I want to say 5 to 6 people that actually like physically bargain. I go in person. I'm the only person for Louisville, Kentucky that goes physically in person, but we have a couple people that stay home and do it virtually.
Uh-huh. And where do you go to bargain? Where are these sessions?
So as much as I can say, we've been to California, we've been to Atlanta, Chicago, just to name a few. But those have all been at the company's discretions, because of safety reasons for them. Not for us, but for them. So I've been to like 5 different places, like all last year, all 9 months of 2024.
Wow, that's a lot. So I know that there are a lot of supporters. I was there on Christmas Eve when you shut the store down where you work over on, where is it? It's on Baxter
Avenue.
Baxter Avenue. And there were a lot of enthusiastic people out there, both from among the workers and supporters there. So what can people do if they would like to support you in this effort?
I would tell people, especially people that use like Instagram, and I believe TikTok is still up and running at this very moment. People that are like younger, use TikTok or use Instagram, or if you're on Facebook, you could always look up Starbucks Workers United. I believe we do have a website, and go there, start there. Or if you're going to a Starbucks and you're going to like Baxter Avenue or Bardstown and Heather or 3rd and Central, just to name a few union stores, go there, ask for people there, get the information, like support us. That's where I would say the most support comes from. And then we have allies that help us out a lot for the support.
Mm-hmm. And it's the website you find at Starbucks Workers United.
Let me make sure I'm correct, because
okay. And I'm Paul.
I don't want to give people the wrong information, because I was very much unprepared for all my stuff. So very much so it's StarbucksWorkersUnited.org.
.org. Go there and you'll find ways to help them. We're speaking with Tamara Bell. She's a leader in the Starbucks Workers United Union. She works here in Louisville, Kentucky, and she's a part of the national bargaining team for the union. Paul?
Yeah, Tamara, I was just curious about within the individual stores, and we'll just speak for here in Louisville since you're most familiar. Do you have 100% participation in the union?
Um, when it comes to stores or unionized stores, we
Yes.
do, and I want to
Okay.
say, like, because we're with like Indiana as well, so we have one store in Indiana that's included with the Louisville stores. So we only have one store, and that store has gone very cold. But we do have 100% participation from the 8 stores in Louisville, eight or seven stores in Louisville.
Okay. But as far as your advocating for a contract, or do you want it to be a closed shop contract? In other words, where everybody, it's mandatory they join the union.
I don't. I want to say like certain things I can't answer, but certain things I can. I don't want it to be a closed shop. But I really would like. I think with our growing movement, adding more stores, I would like people to be like, "Hey, I see what they're doing. I see what they're trying to accomplish. Let's try to do that for ourselves, and let's petition to be a union. Let's start the movement. Let's join the movement."
Mhm. So you're now negotiating just for the stores that have gained recognition through an election. Is that right?
Yeah, so it's probably 500 plus stores that we have nationwide. Um,
Wow, that's a lot.
yeah,
You got
still
something growing
growing.
here.
It's still growing. And thus far, I think that's who we're trying to negotiate a contract for. But if we're adding more stores on, from my knowledge and what I've been told, so the number will probably keep growing. And if we get a contract, all those stores that join will fall under the contract.
Mhm.
Well, that's
Yeah,
what
I think
you
that I
want,
think that
right?
total. I'm sorry, Charlie.
I'm just gonna say that's what you really want, right?
Hmm.
That would
We
be
make
make it so much simpler.
Yes,
So yeah, I'm looking at some data now that says there are over 500 stores now unionizing. That
yes,
sound correct?
yeah.
And how many total stores are there? Do you know that figure?
Ooh, I would like to say we're sitting at like five. I want to say 520,
Uh-huh.
roughly 520. Um, but we had like nationwide, we have like 10,500 United workers that work for these stores. If I'm giving a
Wow.
rough number, so
So that's a big growth in the union movement and in a
Yeah.
difficult industry because, when you have 10,000 workers under one roof, they can talk to each other and organize easily. And to have 10,000 workers in cities all across the country, in stores all across, it's an amazing job that you have done to be able to organize and to make Starbucks come to the bargaining table with you, because I'm sure that their intention was simply to frighten workers into backing away from the idea. So,
yeah, I think that was one of their intentions, but I also think it was to get us to stop disrupting businesses, um, such as like walking marches on the boss, and striking. And they were like, okay, we're going to give you all some type of contract and you're going to like it and we're going to be done with this and we're going to be equals. I think that's what their mindset was.
uh-huh. Tell us about the marches on the boss. Have you done one of those?
I have not, surprisingly. I wish I could have. I still could, but I have not. Marches on the boss are basically where somebody will stop work altogether. Um, and they will basically read out, somebody will read out kind of like, I want to say the right word, kind of like, okay, the manager did this and we didn't feel supported. And they would stop business for like 15 minutes or so and read it out. And then somebody will give a testimony and be like, hey, this at this point in time, I had an emergency and I tried calling you and you all didn't answer. And it escalated to this, and I felt I was not appreciated. I felt that the lack of leadership in the store and so on and so forth.
That's an amazingly powerful thing to be able to do. I know the early days of my union when we were organizing hospital workers who are also notoriously underpaid and mistreated. And we would do something that was called the high noon, which is we went on the lunch hour to see the management. And if we could organize a substantial number of workers to join that, it was very powerful. And it was invigorating for workers to see how frightened management was of just that unity of people being able to do something independently of what the company orders them to do. And it's a powerful feeling. So I'm excited that you're using that tactic of marching on the boss, because it certainly, it's an amazing thing to be able to do in situations where workers are unorganized and the company can fire whenever they decide to do that. And
Yes.
So I congratulate you in this amazing movement that you've been building all across the country. Is there anything else you would like to tell people about the work that you were doing?
I don't think so. I mean, I don't think so.
Okay, all right. Are you in touch with the other coffee shop workers? I think is it the Heine
Honey Brothers. We just say I can only say this from like, not really. Synagogues, yes, because we did help them when we were doing our bus tour. I think about a year ago, Starbucks Workers United launched a bus tour, and we went to several different cities. We here in Louisville, we helped Synagogues with a march on the boss, I believe, and we also helped them march outside of their store here.
Mm-hmm.
So Synagogues did come to our strike this time to help us out, but not much Heine Brothers, because I believe they already have a contract established. So I don't know what's in their contract. They may not be able to cross picket lines. Not too sure. But not really. But all other coffee shops that we know of did come out support us.
Mm-hmm. Are you in touch with other unions in other industries outside of the coffee?
Very much. I have a lot of people on my team that are in touch, like DSL or the U of L, like U of L's DSA or their socialist movement at U of L. Like I have a lot of people that I work with that are in touch with a lot of those people. I myself, I am in touch with University of Louisville's like socialist group, and then some workers from Teamsters as well. But not a lot, but some.
Mm-hmm. I know that the Teamsters are working to organize the Amazon workers, which is also a tremendous nationwide struggle and a giant corporation, bigger than Starbucks even. And I know they're working on that in New York and even here in Louisville and in other places. Do you, you were at UPS?
Yes, I worked at UPS. Well, man, that feels like centuries ago. I worked at UPS for a solid good year. And I was very much well versed on the Teamsters themselves and how it all started. I thought personally I was represented very well. I know that they have their own struggles, and I know that they were trying to renew they renewed their contract. So
UPS here has been an important part of fighting for better contracts.
Oh yes,
certainly they rejected, I think, a contract before that they felt wasn't good enough. So they're a strong union.
What about the Starbucks is a multinational corporation, and are you familiar with unionization efforts in other countries?
Very much so. I did have an interview with some people from overseas that were watching our movement, and a young man who actually flown here during our bus tour came to all different. He was at the start of the bus tour and he was at the end of the bus tour. So and he was like, I've watched y'all's movement from the very beginning, from the first tour in Buffalo till now. It's a very tremendous movement, and it's given me courage to reach out to other like countries like Ireland. Uh, I think it was Ibiza. I'm not too sure that somebody else was from. Other places that seen our movement and want to start their own movements.
Is Starbucks in those other countries?
Yes, we do have Starbucks like in Japan, I believe. I know we have we have a lot overseas. Certain countries we don't have Starbucks in, but they're under different CEOs within those countries, if I'm not correct. So I know we've talked about, a lot of us have talked about trying to get Japan Starbucks unionized, because it seems like that would be the first place to go to, because they have a lot of merchandise and they have a lot of workers that work just like us.
Mm-hmm. I see the symbol behind you for Starbucks Workers United has the flags of many countries. Is Starbucks in all of those nations?
I believe so, yes. We, from my like talks with people overseas, like we do have a lot of Starbucks in different countries except for some.
I
But
see
they
that.
are, go ahead.
Well, the research that I was doing on Starbucks, it said in your movement, it says that about a third of Starbucks Chilean workforce is unionized. Now, I don't know how many Starbucks are in Chile, but that's significant, I would say.
And then besides Chile, we do have, I know in uh Canada, they are now established unions, and I believe they do also, they have a contract.
That's amazing.
This
Have their
this
very
article
own international union.
this article also mentions 450 workers in New Zealand.
Mm-hmm.
Wow, about that.
That's amazing. We've been talking with Tamara Bell. She is a leader in the Starbucks Workers United movement. She works here in Louisville and represents the workers at 8 different stores that have made the decision to go union. And she is fighting for health care for her members. And she also joins us in standing for a national single payer healthcare system that would cover everyone in the whole country. Thank you, Tamara, for joining us, and we wish you Godspeed in all that you do. Thanks for making this fight.
Well, thank you, and I'm glad to be a part of the fight, and I was glad to be on here today. Thank you.
I want to thank Kay and Charlie, and a special thanks to our guest Tamara for a very informative program. And a special thanks to our listeners for tuning in. Please join us next time for Single Payer Radio.